Welcome back. So we have talked a lot about some of the benefits of GLP-1s when it comes to weight loss and treatment for diabetes, but doctors are really using it in another way to help those in recovery. Dr. Erin Wilson, Chief Medical Officer at Meadows Behavioral Healthcare, joins us this morning with how they are using it here in the Valley. It's good to see you, Doctor. Thank you for coming in.
Yeah, thank you.
We were just chatting about the different ways in which you all have been using it. You said it's shown to be very successful.
Yeah, you know, originally it was for type 2 diabetes and then obviously for obesity. And what we've found anecdotally and through some preclinical trials is that it seems to help kind of across the board, kind of quieting noise, not just from the food noise, but we're seeing as it works on the reward pathway, it can actually quiet noise from other addictions as well.
So you mentioned the food because obviously with GLP-1 and weight loss, it helps in that way. I think we've seen a lot of success in society with that. What about when it comes to opioids or even like nicotine addiction or alcohol addiction?
Yeah, exactly. I think the biggest momentum right now is for alcohol use, and I think the correlation there is because alcohol has caloric content. So because of that, of course, it can decrease your craving for carbohydrates. So we're seeing a reduction there, but we're also seeing that's being studied currently for nicotine, opioids, stimulants like methamphetamines and cocaine, kind of across the board. And we're also looking in different research trials at like process addictions, like gambling and some of those other things as well.
You know, I was reading a study by Stanford on this, and some of the researchers there are also kind of doing the same thing you all are doing and kind of, you know, working with it and seeing where it can help people the most. What happens in the brain? What is GLP-1 doing in the brain? Is it a dopamine effect or something that it's controlling?
That's exactly right. So it works, I mean, there's GLP receptors, you know, throughout your body. There are also some specifically in the brain, the mesolimbic region, which is kind of the reward pathway. Because of that reward pathway, it's kind of the common final pathway for a lot of addictive behaviors. So because it's working there, that's why we're seeing it kind of cut down on those cross addictions. A lot of people with addictions, sometimes when they cut down on one thing, something else will pop up, like maybe you get away from alcohol and you start eating more. And so what we're seeing is a pretty good effect across the board to kind of quiet that noise.
Once you quiet the noise with the medication, is there any moment where you're able to get off the medication and successfully live without it, or do you have to stay on it?
So that's a really important point. I think where we are right now, it's kind of a longitudinal, like you need to stay on that, because if you do come off of that, I think we're seeing a lot of kind of relapses at that point. So part of this is a huge discussion up front about, is this a sustainable model for you? Are you open to staying on that for a while? It's also, I just want to emphasize, not a standalone treatment, right? You need to do that in addition to working a recovery program, and there's a lot of other pieces to the puzzle which are critical.
You mentioned other parts of the program. So when people come to your center, they are potentially put on the GLP-1s to help in that way, but then are there meetings or other things?
That's exactly right.
Okay.
Yeah, so it's part of a rigorous screening to make sure you're an appropriate candidate. With that, you know, you work with a registered dietitian, a psychiatrist, a whole team of people. Once we select and we find that you're the correct person for the medication, again, it's part of the whole treatment, right? The group programming, AA, all those types of groups that we do. We also do a lot of deep trauma work at the Meadows, so we're really looking at it kind of a three-dimensional view. This is a piece of the puzzle. It's meant to be kind of an adjunctive piece.
Okay, if folks want to reach out, if it's something that interests them, how do they find you?
Yeah, I would say, you know, the Meadows website, which of course we'll mention. The Meadows website is a great way. Reach out to our admissions team. You know, we have, of course, if we can help you at the Meadows, whether it's at the residential treatment centers or many of our outpatient treatment centers, whatever level of care is most appropriate. And if it's not us, we want to make sure we get you to the right place.
All right, Dr. Wilson, thank you so much.
Thanks for having me.
We appreciate your help. We're going to take a quick break. We'll be right back.